So, as I mentioned, I did research on cardiac regenerative therapy using iPS cells when I was a research fellow. And in 2019, I attended the annual scientific meeting of the Japanese Association for Thoracic Surgery. At that time, I had an opportunity to meet Dr. Shinya Yamanaka, who invented iPS cells and who was awarded Nobel Prize in 2012. Also, in 2020, there was a COVID pandemic, as you know. I work for a hospital in Bronx, New York, so we could not do surgery for a while during pandemic, and I had a time to think about my research. These experiences inspired me to pursue cardiac regenerative therapy using iPS cells. Yes, so I believe it will probably take another 10 years before stem cell-based cardiac regenerative therapy becomes widely adopted in clinical practice. For this therapy to become a standard treatment, its efficacy must be clearly demonstrated through future clinical studies. To date, I believe the safety of iPSC-based regenerative therapy has been largely established. Concerns regarding tumorigenicity and the development of serious arrhythmias have been addressed to a great extent through previous studies. However, for this therapy to be accepted as a standard of care, additional clinical trials will be necessary to demonstrate its therapeutic efficacy. In addition, the mechanism underlying the therapeutic benefits of iPSC-based regenerative therapy have not yet been fully elucidated. A better understanding of these mechanisms will be essential for this therapy to become a standard treatment. All of the clinical studies currently underway are using allogeneic grafts, which require immunosuppressive therapy. However, research using autologous grafts is also being actively pursued, and there is considerable hope that these approaches will become clinically feasible in the future. I think that the most important criterion is whether a manuscript provides new knowledge that meaningfully advances the field. Novelty alone is not sufficient. The study must also be scientifically rigorous, methodologically sound, and clinically or biologically relevant. When evaluating a manuscript, I assess the originality and the significance of the research question. Does the study address an important unmet need, challenge an existing paradigm, or provide meaningful new insights?